I'm not sure how I should facilitate the post-activity discussion. Hi, I'm Louise Fouché from OTGrow. Welcome to our YouTube channel. Here we discuss tools, tips, and techniques to make you an effective group facilitator. So if group therapy is a passion or a calling of yours, then you've come to the right place. Today, we're discussing what we call the post-activity discussion. So, just to put it in context, remember we spend about the first third of our time kind of introducing the clients, the norms. We then go into warm up and the bridging, and that'll be the first third. The second third will be your main activity, in which the clients are reaching their goal and they are fully immersed in the experience. And then about a third for the post-activity discussion. What I have found is that the more effective your activity is, sometimes your post-activity discussion does not take so long. The experience was so profound and the insight that came with it so deep that there's very little left to discuss. But if you are preparing your group or designing your group, as we spoke about a couple of weeks ago, then you write down a couple of questions that you are kind of prepare to be able to ask and facilitate specific things during the post-activity discussion. And those can be divided up in a couple of categories. So normally we write down those questions in preparation as part of our group protocol. And in the moment, we're going to see which are the ones that we're going to be using. Sometimes you might ask a question and nothing really comes from it. And then you ask another question and a big discussion emerges from that. And then you go with the flow and you then continue to facilitate the discussion, indicating that this is the need of where the group is at that moment. So when you come to the planning phase, so what should you be asking? What are the questions that you should be preparing? So they come in different categories. The first one is to just reflect on the experience. And normally we start with a very open-ended question. What was that like for you? Because anything can emerge from that. People can say, wow, this was profound, or that was really so uncomfortable for me. I really didn't like that. Or, you know what, it was okay, whatever. So you have a very open blanket way of starting the post-activity discussion. So normally that's always the first question I ask. And plan. What was the activity like for you? How was the experience for you? Then you can start by, in your planning, also putting one or two questions that would facilitate specific curative factors, knowing that curative factors is what makes the therapy part of group therapy. So I can experience something individually, but that doesn't necessarily mean I've tapped into the group dynamics or the fact that we are in a group together. When I facilitate curative factors, there's always that concept, but also the connection with the group. And so I might write down a question regarding universality. In other words, I might plan in my post-activity discussion, my planning question would be, who else experienced or found it difficult to trust in this group? Or I might ask, has anybody got feedback on Mrs. So-and-so's experience facilitating interpersonal learning? Or I could say, who did you feel the closest to? And give that person feedback. That might also be interpersonal learning, getting feedback from other people. And so I might structure these questions preempting that these are things that might arise in the group. The third thing that I can plan for in terms of my post-activity discussions is something around the group dynamics. In other words, if we possibly did a group on trust and we individually had to learn to trust group members, I might want to test the water in terms of the group dynamics. In other words, the part that is bigger than the sum of the parts. In other words, I might say, how do you think the group's trust is? Does the group trust itself? In other words, it's no longer individuals, but it's on a bigger scale. And so I can ask a question on a bigger scale. If we had a group around forgiveness, we might ask, do you think that this group is a forgiving group? And again, to keep it away from the individuals, but just as a group, almost testing the waters. What does the group think about the group? So I can ask some group dynamic questions. I can also ask questions with regards to very specific things I wanted to find or facilitate within the activity. So the activity itself, I might say, all right, so we did a lot of things changing. What does that make you aware of? What is the insight that brings you with? Or I noticed XYZ happening in the group, or I noticed XYZ happening individually, and I wonder what you would like to make of that. All right, so we've got basically four kind of categories that you can cover in your preparation that you can then lean into. The one is just the actual group experience, the actual activity experience. The second one is very specific experiences of people or of the group that you noticed. The third one is the facilitation of the curative factors. And the fourth one is in terms of the group and the group dynamics, where we are giving space and time for people to step back and have a look at the whole, the group as a whole, and what is that whole and the impact on the individual. All right, I hope that gives you some guideline when you sit down to prepare your group and write some questions for your post-activity discussion. It shows you where are places that you can start and not to get stuck just on one element, but to make sure you incorporate questions on all four of those levels. All right, I trust that that's also going to bring some interesting conversations to your post-activity discussion. The more skilled you become at asking those questions, you're also going to find that the depth of your discussion is going to increase. All right, so try that for this coming week, just focusing on asking questions and planning them for your post-activity discussion. And in the meantime, happy facilitating.